right there. Okay? It's a little tender, but right under there is the first rib. Okay? It doesn't attach to the sternum. It's right there. With this other hand,
I already feel it in the back.
yeah, you already feel it back there, don't you? With this hand, you're going to put the pads of your fingers just off the spinous processes of C7T1 and then slightly turn them this way in plane with the rib, right? Okay, anatomy matters. Anatomy lives matter too, right? Okay? It's anatomy, gang. We got to know our anatomy, don't we? Who forgot a lot of their anatomy like the first 5 years out of school? Oh my gosh, I forgot so much anatomy. Okay? And then I figured out, and when I started working with these manual therapists, I figured out anatomy. Oh my gosh, yes, it does matter. I need to go back and remember it. I had to almost relearn some of the biomechanics. Okay? So, hands back here, push this way, and you will feel in the back that rib come into your fingers.
Where exactly is the bottom hand?
Right off C7T1 spinous processes, this way. Here's the scapula, medial border of scapula. It's right in here. Okay? Somebody put their hand on top of my hand back here. Somebody. Okay, you're past my fingertips. Go right. You're still past them. Yeah, because I want you to feel this.
Mm-hmm.
What do you feel? You feel
Popping
something.
right
You
in
feel
the
something
movement.
popping right into your fingers.
Mhm.
Okay, that's the rib. Pretty cool, isn't it? So now what you're going to do with this hand and this hand is you're going to capture that rib and do this. Okay? In some patients, they'll say, oh, that feels good. It's a little tender here, but they'll say, oh man, that feels really good. Okay? And I got this lumbrical grip thing doing here. Huh? OTs, huh? Lumbrical? Huh? You remember that? This. It is lumbrical, isn't it? Okay, thanks. Just checking. I hope so, because that's what I'm saying. Okay? It's this. To it. Okay? Now, keep your hands back here. Come across to this other side. And gently, with the hypothenar, hypothenar. Okay? Don't jam it into their throat, okay? If their lips are turning blue, back off. Gently, I'm doing that almost. But that movement is going what? Right that direction, correct? And I'm kind of pushing on the anterior portion of the posterior rib. Okay? And you will feel these spinous processes do this. Right into your fingers. It's very dynamic. And it's takes very gentle. It didn't hurt here, did it? It's very gentle. Okay? Somebody put their fingers under mine here. Right off the sides of the spinous processes. Okay? Feel that? Okay. So, just doing that right up there, you're mobilizing C7T1 using the rib as a hand. Am I going to have to work harder with to stabilize? This one on the rib or this one? This one. The rib is a longer lever. So I got to work a lot harder on this little short spinous process. It looks like this. So I'm going to make sure I'm where I am. That's where I am. I want to be there. I feel it moving. I'm going to go one lower, and I'm going to really dig in there and block that. The funny thing is when I did that, I felt her rib come into my hand over here. Okay? And I'm going to press. Press. It's a little more uncomfortable, but I'll literally do it 2 or 3 times just like that. Okay? And then I may go back to the scalenes.